All right. Got recording on.
Let's record.
Yep, recording now. So we got Dr. Joe Cangas, Ideal Pediatrics. Joe, if you want to kind of introduce yourself.
Sure. Like I said, my name's Joe. Actually, it's Cangas, but that's all right. I'm pretty used to that. It's a pretty common thing that happens with my name. I do have a couple of practices in the St. Louis area, Whole Child Pediatrics here in St. Louis and Freeport area, and then I have Ideal Pediatrics in Columbia, Illinois.
Very cool. So how long have you been in business?
So I've had Ideal Pediatrics for 14 years now. Opened a couple years out of residency. My first job was in Salem, Illinois, and it was a little far from reality for me. So I needed to be a little closer to the city, and came over to found Columbia, Illinois, a nice little town, but needed a pediatrician. There wasn't one in the county, and I said, hey, maybe I'll open a practice here. And I've been there 14 years now. And then Whole Child Pediatrics I've had for just a little over a year, and it's just my attempt to have a practice a little more natural approach. So ultimately just think that too many kids get medicine, and so I'm just trying to do my part in helping that journey.
Oh, appreciate it. Yeah, no, and you're one of the few doctors I've known that's networked too, because we obviously met at a networking group called ICAG. Very
Right.
cool concept.
Yeah. I think it's it's something I didn't do for the first basically 14 years of my practices, but I've really learned that I've lived in this area for 14 years now, and I knew my patients and their parents, and I realized I needed to expand that network of mine a little bit just to get to know people for personal reasons. Even, when I need a plumber or an HVAC guy or an insurance guy, I didn't know where to go without asking, going to Facebook and then getting hundreds of replies. So it's been a real good experience for me to make friends, as well as relationships, and to build my practices.
Same. Yeah, so wanted to kind of get into it too. Part of this would be putting people at ease, or more so answering some questions that there's so much conflicting information out there. And I mean, people know you in St. Louis. You're an awesome guy. You sponsor a lot. You do a lot with the community. So first thing that I get a lot from friends and family is, how long is this going to last? Like how long would you say we're flattening the curve? That means it's going to take a little bit longer. Should I be worried about being in my house for a little bit, or what's your thoughts?
I think, I saw what President Trump said a couple of days ago about, July or August. And I don't think that's far-fetched. I think that, we got to do our job to keep it down, to a low level, and to keep it from becoming the peaks that we've seen. Italy's numbers just surpassed China's. And while I've seen reports, and I haven't been able to confirm them, that China's numbers are clearing, there's no new cases, and that very well could be true, because they started back in October, I think it was, or at least November. And so, that's that few months, and we just started a month or so ago, and so we've got a little ways to go before we can be in the clear. And the longer, I guess, the more that we do that, the quicker that's going to happen, I think, is kind of the biggest thing that I have to promote, is that we've seen a lot of people, and I have a lot of people concerned, like, well, it's nothing, it's going to amount to nothing. And I think that's the goal of ours, by staying home, by shutting our businesses even, which has been hard for a lot of us, reducing our business, spending our time at home. I mean, I should be right now at the NCAA tournament watching basketball. That's where I should be. And my heart hurts a little bit because I'm not there. But, it's not about me. It's about the better of all of our country, and those that can't protect themselves from this disease and who might have worse outcomes than us.
Well, that's a good segue too, because the next question I was going to ask you, somebody like myself, somebody like you, somebody like most of your patients being kids, how much does that affect us? How much does it affect who they come in contact with? Because we're obviously doing this priority number one for the elderly and immunocompromised. But can you kind of talk to, hey, is there data out there that say I should be very worried? Or is my main focus, hey, I should be worried because I don't want to give it to grandma and grandpa over there, or somebody that, God forbid, they have lupus or some other disease that kind of shuts down their immune system?
That's another thing I see on Facebook a lot. Like, people will share that I had it, I wasn't that sick, and most of us won't be that sick. And that's what makes it hard for us to stay home when we're protecting everyone else, other people, and not ourselves. We're not worried about ourselves getting sick. If we're healthy individuals, we should get a cold, a cough, maybe a prolonged cold and cough, maybe a little chest pain, but we're not going to have horrible outcomes. So much so that even kids may be asymptomatic altogether and be carrying it and giving it. I've read many reports of that. I know that what I've seen so far, the incidence of the mortality in kids 0 to 9 was 0% last I saw. So, I mean, that's a great thing. That's good for my patient population. However, having those kids out, having them asymptomatic, shedding that disease is going to be, hard on others, especially like you said, the elderly, anyone with chronic illnesses. I think that, again, we've done a good job of keeping it away from the kids who have those chronic illnesses, and that's our ultimate goal, not flooding the areas where those kids are going to be, staying away from them, staying home, uh, washing our hands, for instance, using hand sanitizer, all the due diligence we should do all the time. And I've told patients I'm not sharing any new information with them that I don't share every cold and flu season. Wash your hands, stay home if you got a cough and cold, and don't cough on people, and we'll all be better and healthier in the long run.
Yeah, and so a lot of things I've seen too, it suggests that 50 to 60% of the population will get it at some point, and not that that should scare anybody, but it actually probably give them more peace, because for what we're doing now, it's just lengthening that timeline. And all 100 of us aren't going to the hospital at the same time. Maybe it's one here, one next month, one month
Right.
after. Is that kind of the thought process behind flattening the curve?
When you see those peaks, like they're seeing in New York, for instance, their ERs, their emergency rooms, their ICUs are flooded. I have a friend out in New York who had to intubate 4 ICU patients that had coronavirus in the same day. I mean, first of all, his risk of exposure is up, and the fact that there's 4 in the ICU in one day that have been added to their ICU, and that just tells you how the ERs, the ICUs, the hospital system could just get flooded with patients, and that overwhelming the hospital system is, could be detrimental to many people if they don't have access to that care. They can't get into that hospital, can't get the care, the ICU bed they need.
Yeah, shoot. Well, and then you go back to the other extreme. So the general population definitely is fearful right now, right? So there's a lot of mental health concerns. I mean, I've
Anxiety for a number of reasons. I mean, there's anxiety. What if I get the illness first? And like I said, most of us are going to just get a cold and a cough and be fine with that. But there's a lot of people out of work. There's a lot of people that don't know if they're going to be out of work. I mean, even my own offices, I have 3 employees that are taking a little more time off than usual right now, and not sure when or if they'll be back to work. And there's others who are still working, and even like myself, my patient counts are down because most people are staying home because they don't want to be out, and I don't blame them at all. And in no way is that, I mean, that's what they should be doing, and they're doing the right things, but it sure is stressful for even me in this situation.
no. So what are some things? Because obviously the immune system goes down when you're stressed. What are some things we can do to both strengthen our immune systems and then de-stress? I mean, what are some good things for mental health that we can?
Sleep is key. I think that, again, when you're stressed as well, it can sometimes be hard to sleep, but getting adequate sleep and a good quality sleep is going to be very important. Staying hydrated, always important, but important for our health, our well-being, our mental health, and for our immune system. People load up on their vitamin C. We know that vitamin D is beneficial as well for our immune system. I've read a lot of studies about CBD being good for immune system. It's really just staying healthy, washing your hands, staying away, eating a good variety of foods, avoiding your junk foods, avoiding any excessive alcohol intake, all things we would talk about just being healthy in general in the first place.
Oh, shoot. Would you happen to know a CBD supplier?
I mean, I might know a guy who has a CBD product out there, but I'm sure not going to say, like, I've seen people post how it cures CBD, and I've even seen people talk about vaping CBD being protective, and I'm not going to go that far, sorry.
No, for those that don't know, Joe has a line called Ledexar CBD products, very good. But he's not a snake oil salesman by any stretch of the imagination. He'll kind of shoot you straight what it's used for. And
yeah, I just developed that line so my patients who did want to use the product, and the parents would have a safe, reliable product to use, would know that what the label says is what's in the bottle. And besides that, I'm not here to say everyone needs CBD, but for any stretch of the imagination.
it's awesome. So what are some things too, as we're quarantining, as we're self-distancing, doing all the things right? Is there anything additional we should expect in the days to come? Because we're probably going to see larger numbers, I got to expect, and that's going to cause a little bit more anxiety. But
Right. See, right now, I think one of the things, we're doing things a little differently every day. Something changes every hour. I make a post for my practice, and I tell my staff before I leave work for the evening that this is what we're going to do tomorrow. And then I come back the next morning and say, oh, never mind, this is what we're going to do today. And that even changes throughout the day sometimes. In my practice, we've moved to a lot of telehealth visits. Actually, every sick visit starts as a telemedicine visit right now. And I've expanded that to, basically all of Illinois and Missouri can access care through my practice in order to stay away from, going to the hospital, going to the ER, especially if they don't have care in an area that doesn't have access, or if they have a doc they just can't get into right now, because some offices are closing, some are only seeing well, some are only seeing sick. Everyone's kind of got their own thing, but in my practice, we're just seeing the well kids in the morning, clearing out, and then in the afternoons, if there's someone that really needs to come in, we'll see them at that time. But right now that's because we don't have any known community spread, meaning person-to-person transmission. We have people who have come to our area and brought it here, but we've caught those cases and they've been in isolation, and hopefully we'll keep from having community spread. But the moment we know a case was spread from a community member, then all those things will change, and we may even see a quarantine in our area. And that's some of those things you don't really want to talk about, because I don't want to scare people, but it could come. It is one of those situations we don't really know exactly what to expect. But in that time, how we help that is by not going out. We don't have to. Don't put yourself in a situation to get exposed by someone who might be in a place that doesn't know they're already carrying it. Stay home when you can. Don't congregate in groups. Don't use it as a time to go on vacation because you have all this time off of work. I know there's a group of guys I like to play some cards with that, I got the call last night, are we going to still do that? And I said, personally, I have to be that good example, and I can't go, whether if you get together or not. I'm just choosing to be the example in the situation, and I'll be staying home, and maybe we'll find a way to do some online card game or something. But I've got a 15-year-old daughter who is begging to go to her friend's house. It's like, I'm so sorry, honey, and I don't know how long this is going to be, but we really have to make the right choices for ourselves and for our kids. Even when it's not fun. Like I said, I would want to be at basketball right now. I had plans to go to Top Golf tomorrow or Saturday and hit some balls, and there's just things that we're not going to be able to do that we would want to do, and that may continue for a while. But it's really just, as long as the recommendations are out there, following them as closely as you can is going to be really important.
Most definitely. Well, and you being this wealth of knowledge for everybody, I know I definitely appreciate it. So the telemedicine, going back to that, I know you service, you said from people 4 hours away when we were discussing. So what should somebody use your telemedicine for? And when should they go directly to, say, an ER or an urgent care? Because, yeah.
Yeah, for calling the practice for being seen by telemedicine, generally, I would be doing ADHD, anxiety, mental health things that I could do without needing a physical exam. Maybe a rash or a pink eye that I might be able to see on a video. Even that can be difficult sometimes to really tell what's going on, because the quality of both ends on the internet plays a role in what that looks like. And at this point, though, we're really seeing anything and everything, and at least initially as a screening. I mean, clearly, if you have shortness of breath, fevers you can't break, then those are times you probably want to go to the ER, and you might even want to call ahead to see, like, is now a good time to come, or can I be taken back to a room? How you avoid the situations. But letting an ER know you're on the way even is probably an important thing if you're going to have to use one. But I think the telemedicine platform can be a nice, quick, let me take a look at you. I can see how you look, how you're breathing, and see if, like, yes, you really need to go to the ER right now, or no, let's do these simple things at home and try to stay away from that, where you might get exposed to something else or expose someone else to something else if you can avoid it.
Very cool. So really stop the spread.
Exactly.
And kind of be smart about it. So yeah, I mean, and amongst all this other things, other people will experience other illnesses or.
All right, influenza A is still climbing in this area. I saw the numbers from last week, and they're higher numbers than I've seen for a long time. So most likely, if you've got a cold, cough, and a fever right now, you have influenza A, or one of the other viruses we see all the time. So yeah, you don't need to freak out when you have those symptoms. You just treat your symptoms, stay home unless you have worsening symptoms, chest pain, troubles breathing. Those are times you don't want to go to the ER.
Most definitely. You kind of put a nice bow on it. Is there kind of a way you can compare COVID? I know there's not really no way because it's a novel virus, it's new. But if you had to compare it to the severity of a flu, or not to put it in a box, but just ease people's minds, like, hey, this isn't a death sentence.
I think that, like you said, the cases we have, the cases we've seen, the cases we know of are very mild. Most are colds, coughs, dry cough, even not a severe cough. There can be some shortness of breath, some chest pain, some chest burning, but most of those symptoms are very mild, especially for my patient population. And then even, the younger adults and some of the middle-aged adults, I guess I have to call myself these days. I can't believe I had to say that. But, I think that just the colds, the coughs, and I've seen, from the reports I've seen, everything I've heard, it's milder than the influenza is this year. Most of the kids I've seen with the influenza coming in are just drained, miserable, high fevers, aches and pains everywhere, and they're that way for a solid week. So I think that it's a much milder version, and it's just, again, no matter what you have, stay home, wash your hands, cover your cough, clean your surfaces, clean your doorknobs very regularly. Don't share it with anyone that you possibly can avoid sharing it with.
I know you're probably gonna be busy over the next 2 weeks, so I appreciate all that you do. How would somebody like myself or whoever get a hold of you during this time?
So the easiest ways are start with the websites or Facebook. It's idealpediatrics.com or wholechildstl.com. Phone numbers for that is in Illinois, 618-281-4325, in Missouri, 314-272-4005.
I was expecting it to be a lawyer number 333. No, that's when you said Illinois, but that's awesome. I appreciate you doing this. I think it'll give a lot of, if nothing else, friends and family a little bit of solace, knowing, hey, somebody that has a medical degree, they paid attention to this, and they're keeping their wits. It's not losing your wits, but keeping them.
I appreciate you having me, Keith, and hopefully we can answer some people's questions. Like you said, put them at ease, and I'm happy to answer any questions, or if you come up with another list or have more concerns, let's do this again sometime.
I like it. Thanks, Dr. Joe.
Oh, you're welcome. Thank you.